Welcome to week 5, chapter 34 in Nursing 101. This week we're going to be covering the nursing assessment. So chapter 34, what is a nursing assessment? It is a systematic and continuous collection and analysis of information about a client. The assessment begins with collecting data and putting the data into an organized format. Prioritization is very important of the data, and so we always want to look at prioritizing the information that we collect, because existing needs are often the priority over potential needs. So in nursing, the nursing assessment directs all the other steps of the nursing process. So data collection, sources of information about the client. We can get it from the client and their family members. We can get it from other healthcare members of the healthcare team. The client's previous and present health records. We can look at lab reports, reference books, and physical exams. Physical exams can yield important data. Methods of data collection is our observation, which relies on the 5 senses: sight, touch, hearing, taste, and smell. The health interview, that's where we solicit information from the client. The forms that you use all depend on the facility that you work in, and also the physical exam. Now, what we have to take into consideration when we collect all this data is the difference between objective data and subjective data. So first we're going to talk about objective data. Objective is all measurable and observable pieces of information about the client and their overall state of health. Remember, objective data is measurable and observable. Only precise, accurate measurements or clear descriptions are used. It includes vital signs, height, weight, urine volume, measurements of a body structure and function using instruments or lab test results. Radiologic diagnostic tools, but lab test results, vital signs. Those are objective data. Remember, objective data are measurable and observable. Objective data does not include the nurse's interpretation of observed data or a client's statement of symptoms. Subjective data is the client's opinions or feelings about what is happening, the client's communication through written words and body language. Information that cannot be confirmed through any other source. It is obtained by using sharp interviewing, listening, and observing skills. So remember, subjective data, it can be communicated through body language, gestures, facial expressions, and body posture. It is both spoken and written words, and a lot of times the patient's body language can tell you the client's opinions and feelings. So question, the client complains of a headache and fever. However, she has not recorded the temperature. This is an example of subjective data, true or false. That is true because it's based on the client's feelings. If the temperature is measured by a thermometer, then that data would be objective. Observations. We can do an assessment tool that relies on the use of the 5 senses to discover information about the client. Visual observations. Some examples are their body movement, the client's general appearance, their mannerisms, facial expressions, mode of dress, nonverbal communication, interaction with others, use of space, skin coloring, Visual observation, you collect subjective data. You can also use visual observation to collect objective data, such as when you inspect the client's skin for rashes or irritation, or and then you can note the cleanliness and level of safety of the client's immediate environment. That would be objective, where subjective would be the client's facial expression and body language. Tactile observation, that is, sense of touch provides valuable information. Touch or palpation of the skin assesses factors such as muscle strength, temperature, moisture, edema, rash, or swelling. Auditory. Hearing allows you to listen actively to your client and their family members, but you may also use specialized equipment to listen for information, such as listening to the heart, lung, or bowel sounds with the stethoscope. So auditory may be using a specialized piece of equipment. Olfactory or gustatory observation, the sense of smell identifies odors that can be specific to a client's condition or state of health. Olfactory observation includes noting body and breath odors, which might indicate alcohol intoxication, poor hygiene, or metabolic acidosis. The sense of smell and taste may also help you detect harmful chemicals in the air. The health interview. It is a way of soliciting information from the client. It uses a combination of open-ended questions, detailed questions, and observational and tactile skills. Remember, clients do have the right to refuse to answer questions they believe are too personal. And then the medical history. A healthcare provider obtains information from the client for a medical history. The medical history, the healthcare provider obtains that information. The nursing history is the nurse obtains that information. So question, a 15-year-old client who is experiencing lower abdominal cramps admits that she has had an abortion in the recent past of which her family has no knowledge. The nurse is required to inform her parents as she is underage. True or false? That is false. The nurse must protect the confidentiality of the client, never revealing any information previously unknown to the family without the client's permission. What are components of the nursing history? A complete health history helps develop an effective plan of care for the client. It includes biographical data, which includes their name, age, birth date, spouse, support person, children, address, phone number, occupation, financial status, insurance, and so forth. Also includes the reason for coming to the healthcare facility. It also includes recent health history. It includes symptoms of recent disease treated with medications or surgeries. Important medical history. It includes family history of diseases, allergies, immunizations, medications, etc. Pertinent psychosocial information. Addresses family relationships, employment, living conditions, and emotional stability, sexual relationships, substance use or abuse, medications, and so forth. And it also includes the activities of daily living. It involves how well the client is able to meet basic needs, such as eating, drinking, bathing, dressing, and toileting. Does the client get an adequate amount of exercise, food, and rest? During and after data collection, critically examine each piece of information to determine its relevance to the client's health problems and its relationship to other pieces of of information. I don't know where I got the word furniture from. Information, sorry about that. That was out there for a good laugh today. It's a thorough, systematic data analysis, draw conclusions about the client's health problems, and during data analysis, you use critical thinking skills. Recognizing significant data. When preparing to analyze data, ask yourself which items are pertinent to the client care and which aren't. Validate your observations. Validate observations by checking if they agree with what the client is experiencing. And recognizing patterns or clusters. Symptoms can be grouped together in clusters for further analysis. An example would be like they're complaining of heartburn. Question would be, do they have a history of digestive problems? So think of that as an example. You know, they complain of heartburn, but do they have a history of digestive problems? Systematic data analysis. Identifying strengths and problems while assessing the client. The nurse should look for strengths and the client has that can be used in coping with problems. Reaching conclusions. The client doesn't have a problem. The client may have a problem. The client is at risk for a problem, or the client has a clinical problem. And this information is on page 420 of your book. So if the client has no problem, no further nursing care is needed. If the client may have a problem, you want to gather a little bit more information. If the client is at risk for a problem, you want to continue through the nursing process by planning, implementing, and evaluating. And if the client has a clinical problem, then the client has a nursing diagnosis or medical diagnosis. The problem is a nursing diagnosis if it falls in the domain of nursing, and nursing staff may treat it without consulting a physician. If the problem requires medical treatment or medical diagnosis, you have identified a collaborative problem. When this occurs, you must consult a physician and work together to resolve the problem. So, a medical diagnosis falls in the domain of nursing, and nursing staff may treat it without consulting a physician. True or false? That is false. A medical diagnosis is a collaborative problem. The nursing staff must consult a physician and work together to resolve the problem. Whereas a nursing diagnosis falls in the domain of nursing, and nursing staff may treat it without consulting a physician. That is the end of chapter 34. The homework for chapter 34 has been opened. I will put it to review on Wednesday morning at 10 o'clock. Remember, at 10 a.m. on Wednesday, I will be opening up a quiz number 2 in Socrative for you to take. I sent an email via your My IoT. It is under week 5, this week's message. It gives you the room name to sign into for the quiz on Socrative. You will have 24 hours to complete that quiz, so please make sure you get it done. If you have any questions, I also uploaded a study guide for that quiz to week 1 references. But if you have any other questions regarding anything, please contact me via email, and you guys have a great week.